excited to be talking about diabetes and your heart. With that, we'll get started. Okay, so for today's agenda, I'm going to cover what diabetes is and how it's classified. Next, I'm going to give you an overview of cardiovascular diseases and other conditions that impact our heart health as well. Then we're going to talk about what we can do to maximize our health and help prevent these conditions from occurring. Right, so diving right in here. So before we discuss diabetes in full, I did want to take a step back to discuss what glucose is and how it functions in our body. So when we eat carbohydrates, for example, things like noodles, bread, potatoes, the carbs from these food, they are metabolized and broken down into glucose. So glucose itself is just the simplest form of these carbs. So it's easier for our bodies to absorb the glucose or that sugar for energy. Our bodies also prefer to use glucose as its main source of energy, and this glucose is carried to all of our cells in our body for energy to sustain life and go about our day to day. So we need glucose circulating in our bodies all day long. So naturally, our levels are going to rise and fall throughout the day. However, when our glucose levels become elevated consistently, it may indicate that either the pancreas isn't producing insulin, or maybe that the insulin itself isn't working properly to convert that glucose or that sugar into energy. So high levels of blood glucose may indicate diabetes or prediabetes. So when we eat a meal, it does trigger our pancreas to release insulin. So insulin itself is a hormone that essentially allows glucose into our cells. So when we're thinking about the relationship between insulin and glucose, we're going to think of insulin as a key and then our cells as a lock. So the insulin acts as a key basically to unlock our cells so then that glucose or that sugar can get into the cells and then they can use it for energy. Insulin also helps to store glucose in our livers and our muscles. So this is released and used for energy later on in between meals. Okay. So now that we have a background on glucose and insulin, we can talk about diabetes. So diabetes itself is a condition that affects the way our body metabolizes and utilizes that sugar, or also known as that glucose. We have a couple different types of diabetes as well. So type 1 diabetes, your pancreas produces little to no insulin. So insulin injections are necessary for people diagnosed with type 1 diabetes. In type 2 diabetes, which is more common, so your body either A, isn't producing enough insulin, or that insulin isn't being used effectively. So therefore, we have a lot of blood circulating, or we have, a lot of glucose circulating in our blood. And then that signals to our pancreas to keep producing constant insulin. Then our cells start to become resistant to that overload of insulin, and it stops taking in that sugar properly. Then we also have gestational diabetes too. So this is defined as high levels of blood sugar during pregnancy only. So it itself is not overt diabetes. And this happens because during pregnancy hormones can interfere with the insulin function. So this in return can cause higher levels of blood sugar. And according to the American Diabetes Association, nearly 10% of pregnancies in the United States are affected by gestational diabetes every year. So regardless of the type of diabetes, we want to make sure that our blood glucose remain in that healthy range. Because if our blood glucose is consistently elevated, it can lead to complications down the road, such as vision impairment. It could cause nerve damage, slow wound healing, and even kidney damage down the line. Okay, so here are the categories for glucose and then their respective ranges. So we go get our blood glucose taken, it is drawn in a fasting state. So that means, no eating a meal about 8 hours before you get your lab work done. Because if we eat a meal, it might skew our results. So if you have gone to your doctor and your blood glucose does exceed 99 milligrams per deciliter, it is important to confirm if you do have diabetes or pre-diabetes with an A1C test. So your doctor would follow up with that, and basically an A1C just shows your average blood glucose levels over a 3-month period. Okay, so again, as I mentioned, gestational diabetes is a type of diabetes that develops during pregnancy only. So, this happens because during pregnancy, again, a woman's body makes more hormones, and it goes through other changes such as gaining weight. So these changes cause body cells to use insulin ineffectively. So to test this again, the blood glucose will be taken, and then a drink containing a solution of 100 grams of glucose will be consumed, and then the blood is later retested. So here on the slide are the diagnostic categories based on the timing of that test. So now we are going to review heart disease and the conditions that can affect your heart health overall. Okay, so first up, we have hypertension. So hypertension basically just means high blood pressure. And it is a measure of the pressure in your arteries as your heart pumps blood. So this is important because if our blood pressure is elevated for too long, it can cause damage to our blood vessels and other organs throughout our body. So this can increase our risk for a heart attack, for a stroke, aneurysm, can induce heart failure, really just, again, reduce blood flow to certain vital organs. And here we have the different ranges for blood pressure. So we want our blood pressure to be in this normal range. Ideally, that's going to be less than 120/80. So at the top here, we see systolic and these diastolic numbers. So systolic is the pressure when the heart is beating and the arteries are filled with blood. And the diastolic measurement just measures pressure in the arteries when the heart is beating in between, or is resting in between beats. So as we want our blood pressure to be less than 180 or 120/80, and anything elevated is exceeding 120. And then that would be getting to this hypertension range in this orange category, as we see here. Okay, so next up is cholesterol. So cholesterol itself is the waxy fat-like substance that's in our cells. And total cholesterol really, it includes the different components of cholesterol. So it umbrellas over LDL cholesterol and our HDL cholesterol. So with LDL cholesterol, which is what we refer to as our bad cholesterol, this is because it can, if LDL cholesterol is increased, it can build up and form plaques in the walls of our arteries. So this is important because if our LDL becomes too elevated and it does form plaque in our arteries, it does slow down the blood flow to the heart and can lead to coronary artery disease. So coronary artery disease, or CAD for short, is really just the narrowing of vessels supplying the blood to the heart. So if we have CAD, this can increase our risk for heart attack as our blood supply to the heart is delayed and lessened. Here we have the ranges for LDL cholesterol. So healthy range, we want our LDL cholesterol to be less than 100 milligrams per deciliter. And then near optimal, above optimal is going to look like 100 to 129 milligrams per deciliter. Becomes borderline high when it's 130 to 159 milligrams per deciliter. It's considered high when it's in the range of 160 to 189 milligrams per deciliter. And then it's considered very high if it exceeds 190 milligrams per deciliter. So I saw someone just chatted in HDL cholesterol. So yes, HDL cholesterol is considered our good cholesterol because it helps to remove other forms of cholesterol from the bloodstream. So we want this number to be high. So we want our blood pressure to be lower. We want our LDL cholesterol and our total cholesterol to be lower. But since our cholesterol is the good cholesterol, we actually want this number to be higher, which we'll go over the ranges in just a bit. So we want this to be higher because, again, this HDL cholesterol travels throughout our body. It collects that bad cholesterol or the LDL cholesterol, picks it up, takes it to the liver processes it, and then it removes it from our body. So again, if our HDL cholesterols are high, it helps prevent the buildup of the LDL cholesterol in our bloodstream. So we want to keep it in that healthy range to help lower our risk for heart disease or a stroke. So here are the levels for HDL cholesterol, and ideally for men, we want it to be greater than 60 milligrams per deciliter. We're considered at risk if it's less than 40 milligrams per deciliter. And for women, we want it to be greater than 60 milligrams per deciliter, and women are considered at risk if their HDL is lower than 50 milligrams per deciliter. So as mentioned, elevated blood pressure and our cholesterol levels can lead to cardiovascular disease, or shortly or known also as heart disease over time. So heart disease can be defined as a range of conditions that affect your heart, which generally those can cause a heart attack. So again, we see the CAD here, which is a narrowing of our blood vessels. We also see atherosclerosis, another mouthful to say. But atherosclerosis is basically just the general term, the thickening of our walls of our blood vessels and arteries. So this is important because heart disease can lead to a heart attack. It can lead to chest pain, stroke, and heart failure as well. So here are the risk factors for heart disease. And of course, there are some we can't control, such as age or sex and family history. But there are some modifiable risk factors that we are in control of. So we can control smoking, we can control what we eat, we can take steps to lower our blood pressure, we can take steps to lower our cholesterol levels too, or boost the HDL cholesterol. And we can choose to be more physically active, implementing exercise in our week to week, and also trying to manage stress. These are all things we can control to help promote our health. So now that we've briefed over diabetes and heart disease, we're going to talk about what we can do to maximize our health through nutrition, physical activity, and stress management. Okay, so starting with nutrition here, I first want to establish a baseline knowledge of what a healthy eating pattern is. So for these recommendations, I do reference the Dietary Guidelines for Americans, which is a report that's put out by the USDA every 5 years. And really the goal of these guidelines is to help Americans make healthy food and beverage choices to produce overall health and reduce that risk of developing chronic diseases. So according to the dietary guidelines, a healthy eating pattern includes, of course, no surprise here, eating a variety of fruits and vegetables. We're also going to focus on whole fruits as opposed to fruit juices here. So our fruits and vegetables contain vitamins, minerals, fiber, and antioxidants. And they're also lower in calories. So this is what we would consider a nutrient-dense food. So we're going to try to eat a variety of fruits and vegetables when we can. And the reason we want to, expand how much we're eating the different types is because we find different nutrients in fruits and vegetables based on their color. So for example, our red and orange fruits and vegetables will contain vitamin A, while our green produce will contain more vitamin K and magnesium, for example. So, in order to make sure we're getting all those nutrients, we're going to try to eat a wide range of different fruits and vegetables. We're going to try to get in at least 5 servings of fruits and vegetables per day. Okay, so next up we have grains here. So when we discuss grains, I'm really talking about whole grains here as opposed to refined grains. So we want to focus on whole grains because they do contain more nutrients for us. So they contain iron, whole grains do contain B vitamins, and most importantly, they do contain fiber. So fiber is super important for us. We want to aim to get around 30 grams of fiber per day. Fiber helps us to maintain our blood cholesterol levels. It helps us to feel fuller for longer, which can help with weight management. And it's great for our gut health too. So the reason, again, why we want to focus on whole grains is because if these whole grains are turned into refined grains, we lose a lot of those nutrients, and the most important one being fiber. So when we're thinking about grains, we do want to make sure that at least half of our grain intake is whole grains. So for example, this could look like eating oatmeal for breakfast. This could be a sandwich with 2 slices of white bread. And then at dinner, we choose to eat, a side of brown rice. So some other examples of whole grains would be, whole wheat bread, whole grain pasta, oatmeal, like I mentioned, quinoa, brown rice, farro, and even popcorn too is considered a whole grain. Okay, so next up we have fat-free and low-fat dairy. So I know some people can't handle dairy, but there are a lot of great plant-based alternatives out there. So that's good, because the main nutrient we're focusing on when we think of these dairy products, whether it is truly dairy or plant-based, we're focusing on calcium here. So calcium is super important for us. It helps keeps our bones and our teeth nice and strong. And it also helps with other day-to-day functions, such as muscle contraction and nerve function too. So whether you're consuming dairy as it is or choosing a plant-based alternative, just know that you are getting a good source of calcium. And then we want to focus on a variety of plant-based foods too. So when we think of protein, our mind probably jumps straight to meat. And although meat is a great source of protein, it also provides us with iron. We do want to try to get other sources of protein in our diets as well. Because the reason being, if we include some plant-based proteins in there, we're also getting those vitamins, we're getting those minerals. We're also getting fiber from those plant-based proteins as well. So some sources of plant-based proteins could be edamame. We can put rice and beans together to make a complete protein. Quinoa is great for us too. We can also include fish if we can, instead of chicken or red meat, as fish does offer us those healthy omega-3 fats. So just finding different ways to incorporate different sources of protein is really going to benefit you the best overall. And last but not least, we have oils. So I know oils have gotten a bad rap over the past couple years, but oils are very good for us as they do contain sources of unsaturated fat. So unsaturated fat, which is we would consider our healthier type of fat, this does benefit our hearts the most because it does help to reduce the LDL cholesterol within our bodies. So unsaturated fats, great for us, and we can find, specifically in oils, they're found in olive oil, avocado oil, and walnut oil too. Okay, so now we are going to just brief over, what a healthy eating pattern limits. So this would include limiting saturated fats and added sugars and sodium, which we'll dive into in just a few slides. And if you do consume alcohol, the recommendation is 1 drink a day for women and 2 drinks a day for men. Okay, so for our heart health, we are going to try to limit the amount of saturated fat we're eating in a day. So saturated fats are found in butter, coconut oil, fatty cuts of meat, or processed meat such as bacon, breakfast sausage. Also things like cheese, creams, heavy whipping creams, and pastries. Now we don't have to eliminate these foods, because for example, we don't want to feel deprived if we want a dessert at, in the evening. And also we do get some really good other nutrients from these sources of saturated fats too. For example, iron from the meat or calcium from the cheese. So we don't want to completely avoid these foods, but we do want to be mindful of how much we're eating in a day. And this is because saturated fats in excessive amounts can increase our LDL cholesterol. So again, just as a reminder, that LDL cholesterol is the type of cholesterol that will form the plaque within our artery walls and then increase our risk for heart disease. So there is some room for saturated fats in our diet, but again, we do want to be mindful and try to limit it when we can. And we also want to eat enough fiber. So talked about how great fiber was for us a couple slides ago, but fiber, as I mentioned, does help to maintain our blood cholesterol levels because it works to block the absorption of cholesterol within our bloodstream. So if we can reduce the amount of cholesterol that's absorbed, it wouldn't build up as much in our arteries. So eating fiber is going to be great for our overall heart health. And we do want to focus on soluble fiber for this effect. So soluble fiber in particular, it's found in fruits and vegetables, and specifically, we're thinking the skins of the produce here. So if we eat an apple, the skin of the apple will contain that soluble fiber that's going to really have that best effect on your blood cholesterol levels. And we can also find soluble fiber in beans, legumes, and oats as well. Another thing we can do to really maximize our heart health when we're thinking about saturated fat and fiber here too, is trying to replace sources of saturated fat with a source of fiber. So this could look like, if we're eating a beef taco, that beef would contain some saturated fat. So maybe instead of eating 3 or 4 beef tacos, we have 1 or 2 black bean tacos. So we still get to enjoy the beef taco, but then we are also having a black bean taco, which increases our fiber intake. We're lowering our saturated intake, overall maintaining good cholesterol levels and lowering our risk for heart disease too. And we also want to focus on incorporating healthy fats. As I mentioned, this is great for our heart health because it does lower our LDL cholesterol. So again, when we're thinking about fats, the saturated fat starts with an S. So think of saturated fat means solid. So, for example, the butter is solid, the coconut oil is solid at room temperature. However, our unsaturated fats, or the healthier fats for us, are liquid at room temperature. So here we're thinking about those oils that I mentioned: olive oil, avocado oil, flaxseed, walnut oil. Unsaturated fat is also found in fatty fish. It's found in avocados, nuts, and seeds. It's really, just finding different ways to incorporate those unsaturated fats, whether it's cooking with an oil or maybe adding a couple nuts, sprinkling nuts on, like a salad, for example. All good ways to incorporate those unsaturated fats into your diet. And again, lastly, we sometimes need medication, and that's okay because if we are taking our medication in tandem with making these dietary changes, it's really going to benefit us the best overall. But, if you do have a concern, I would recommend talking to your doctor, of course, before you start any medications, discussing what you can do with your doctor to really level out and reduce those cholesterol levels. Okay, so we're also going to limit sodium. So we do need some sodium in our diet. It is an essential nutrient, and it's used for different functions in our body. So it helps our cells uptake nutrients and water. It helps our nerves carry messages between the brain and our body. And it also helps control our internal fluid balance as well. So again, we do need a little bit of sodium. However, most of us, we eat too much sodium throughout our day. Typically, the American diet provides us with more than double of what is recommended. So again, if we eat too much sodium, this can increase our blood pressure, and later down the line, this can increase our risk for heart disease. So the recommended amount, we want to stick to about 1,500 milligrams to about 2,300 milligrams of sodium per day. One small step we can take to try to reduce how much we're eating is, trying to avoid cooking with salt, with seasoning our food with salt. When we're at the grocery store, we want to look for a labeling that says low sodium or reduced sodium or no salt added. That's going to signal to us that there's going to be less sodium in that product that we're looking at. And if we're eating canned vegetables, again, we're going to look for that low sodium labeling. We're also going to give our canned vegetables a good rinse underwater because this removes more sodium that's in that solution helps preserve our canned vegetables. So we just discussed a lot about what we can limit, but we can also try to reframe our mindset to think about things that we can add to our diet too. So we want to add that fiber. We want to add those unsaturated fats. We also can add potassium too. So potassium negates the effects of sodium, so therefore it helps support normal blood pressure. So really all fruits and vegetables will contain potassium, but some fruits and vegetables that contain lots of potassium would be potatoes, oranges, avocados, bananas, white potatoes, sweet potatoes, all really great sources of potassium. Okay, so moving on to diabetes and what we can eat to make sure we're healthy overall in managing our blood glucose. We're gonna incorporate following back to those USDA guidelines. We're going to eat fruits and vegetables. We're going to make sure half of our plate contains mostly veggies with some fruit. We're going to focus on incorporating nuts, whole grains, and those healthy fats too. We're going to try to limit sugar-sweetened beverages when we can, such as, for example, flavored coffees, sweetened teas, fruit juice, soda, as those do add a lot of added sugar to our diet. And then again, we also want to reframe our mindset. So thinking about things that we can add. So can we add a side of vegetables with our dinner? Can we eat a piece of fruit with our snack? Are we getting a source of calcium each day? Just thinking about how we can really nourish our bodies overall is going to be the best way to manage our blood pressure, manage our blood cholesterol levels, as well as our blood sugar. And again, going back to this, positive mindset, we're going to eat mindfully, stay in tune with our body, taking, a pause when we're eating to assess if we're, satisfied with our meal, or maybe we need to go eat second. So taking time to be mindful, assess how we feel, can prevent some overeating too, and prevent those feelings of feeling very uncomfortably full. We also want to be creative with our cuisines. If we eat the same meals every day, it might be hard to stay on track with eating those fruits and vegetables, whole grains, for example, too. So we're also going to plan out each week's meals in advance if we can. That's going to help us stay on track. Trying to meal prep when we can. So even if that's just carving out a couple of days on a Sunday, making a big batch of quinoa that we can repurpose throughout the week, chopping up fruits and vegetables in advance. Really just trying to dedicate a couple of hours when we have free time can really help us save time in the kitchen later on. We're really busy throughout the week, help us stay on track with eating healthy. And again, thinking about what we can add to our meals. So, if we want ice cream, maybe we have a scoop of ice cream and we top it with some fruit. Or if we're having pizza for dinner, great, love pizza, but maybe we can add a side salad or maybe just a side of vegetables too. So that way we can still enjoy the pizza, but we also are getting a source of vegetables too. That's really going to benefit us overall. Okay, so moving away from nutrition and on to physical activity. So according to the American Heart Association, we want to get at least 150 minutes of moderate intensity aerobic activity per week. So this could be, going for a walk, going for a slow jog, even dancing, doing some chores around the house, going for a slow bike ride. That would all be considered that moderate intensity. Or we can get 75 minutes of vigorous aerobic activity a week, or do a combination of both. So the vigorous activity would be, for example, doing a strenuous hike uphill, going for a run, swimming laps, doing heavy hard work, all that would be considered vigorous activity. And in tandem with our aerobic activities, we do want to include resistance training, building up our muscles at least 2 days a week as well. And some tips for moving throughout the day. So trying to skip the elevator when we can, leveraging our fitness tracking device, set it to remind us to, maybe achieve 250 steps in the hour, or setting a weekly goal just to keep us on track. If we can, trying to use half of our lunch break to take a walk. We can park farther away from the office if it's safe, to increase the amount of steps we're taking. And if it's feasible, try to hold a walking meeting. Okay, so moving on to stress. So stress is typically a physical response. We may feel, that headache, that rapid heart rate. But again, everyone experiences stress differently. So when we're stressed, the body thinks it's under attack, and it activates the fight or flight mode. So in this fight or flight mode, we release a lot of different hormones and different chemicals to prepare our body for physical action. So this in return would cause different reactions throughout our body. So those hormones influence, how their blood flows throughout the body. So it actually diverts blood flow away from more of our vital organs, and it distributes it more to our muscles. So, if we're preparing to fight, so we have the energy to fight or maybe even run away. It increases, our heart rate. It elevates our blood pressure. So this, in effect, can really has an impact on our mental well-being and our physical well-being too. So think about the symptoms you're experiencing in response to stress and how this affects your body, as we can see here from this graph. But remember, there are several steps we can take to really reduce our overall stress levels. So going into stress management, here are the 4 A's of stress management. So as we just discussed, stress can affect our overall health and well-being. So we are going to dive into some tactics today to help minimize stress and boost our emotional and mental well-being. So the first A here, we have avoid. So we're going to try to avoid added stress whenever possible. So this can be, taking control of your environment, planning ahead, or even prioritizing your to-do list by greatest order of importance. So thinking about this, for example, if traffic makes you tense, we can plan ahead and take control of the environment. Maybe, budget in a few extra minutes for our commute, but then we take a less traveled, maybe long route to work, but then we avoid that traffic, which makes us stress. So we may not be able to avoid every stressor, but we can try to alter our reaction to the stressful situation for the better too. So we know stress triggers many emotions, so it is important to learn how to deal with those emotions in a healthy way. So we can take a walk to cool down, maybe for you that's listening to relaxing music, or even maybe if we don't have time to do that, just slowly counting to 10 to recompose ourselves and regroup. So next, stressors can be out of our control. And in that case, sometimes we just need to learn how to accept our stressors. So we're going to try to reframe the problem. We're going to try to look at the big picture and think about it positively. So accepting our stressor, thinking about it in a different way, and maybe reframing our mindset to think of it as an opportunity. And lastly, we can adapt by reducing the stress that we feel. So we can set reasonable standards for ourselves. We can even practice gratitude too. So by practicing gratitude, this can hopefully help reduce our stress over time and helps us to remain more mindful throughout our day as well. Okay, so in the beginning, we did go through the nitty-gritty of diabetes and heart conditions. So again, if you have a family history of, diabetes, blood pressure, high cholesterol, heart disease, or if you have any type of concern, it is important to follow up with your doctor and schedule those annual physicals. It's really important to schedule an annual physical because we, year after year, can trend our lab work and see what it looks like over the years. So if any lab value is out of range, we can address it right away with our doctor and develop a treatment plan. We're also going to eat to nourish our bodies. So we're going to enjoy the foods that we love, but we're also going to think about foods that we can add that will nourish us too. because as we know, nutrition plays a huge role in chronic disease prevention. We're also going to increase our physical activity too, and try to exercise as we can on a daily basis. So I know that's not feasible all the time as we have busy work schedules, but even just doing, a quick walk around the block, maybe doing even just like a quick 15-minute workout in your living room. That's really going to improve your heart health overall. It's going to help manage our blood sugars too. And we know that exercise releases endorphins, so that's going to have a positive impact on our mental well-being too. And lastly, we are going to control our stress. So we're going to set realistic goals for ourselves. Because if we break a big goal into smaller, more achievable goals, this first off provides opportunities to celebrate those smaller milestones. But it just helps us to achieve it a little bit better and a little bit quicker. So instead of one big goal, breaking it into smaller goals, this can help prevent feelings of stress, anxiety, or frustration down the road. And we're going to find activities that relax us and brings us joy, so that in return boosts our emotional well-being. And we're going to leverage relaxation techniques throughout the day to help manage our stress. So maybe that looks like cooking your favorite meal that you really love to eat. Maybe we can go for a quick walk, or simply just taking a few breaths at our desk to help us regroup, recompose ourselves, and refocus on the task at hand. And lastly, talk about it. Seeking social support from family or friends, or even seeking professional help. These are all solutions to improve your mental and emotional well-being as well. Okay. So that concludes the presentation. Thank you again for tuning